So Community Navigation is a new program. We're a grant-funded program that helps families connect to different resources in the community. So our job is to navigate, if you will, those resources. And we set them up according to the needs of the family. We have a conversation with these moms, because we start we start with all prenatal families. We start with mom, but we can help anybody who touches mom. So
talk to me a little bit more about that, because I did not know that. Mm-hmm. I'm learning something new.
So we meet them at their new OB appointment, and we have a conversation with them, see how many other children there may be, who they count on as a support system, and we just kind of have a conversation like we are now, Ms. Stewart, and figure out what their needs are and connect them to whatever resource fits that number.
So in your role, what do you think are some of the resources that people need here in our community to be well?
Housing. Housing is such a big issue right now in our community. Housing. So many waiting lists, so many people with past evictions that are stopping them from getting housing, not enough housing. There's so much red tape to it. Food insecurity. There's still food insecurity. The price of groceries is crazy right now. I think eggs is $4.
Yes.
Food insecurity. Let's see what else. Transportation. And I thought it was because I came from a big city, but transportation here is crazy.
Tell me about it.
Like, there's 2 different bus systems, and you can't get to High Point. High Point has one, and then Greensboro has one, even though they're all in the same county, but it's still 2 separate systems, and they don't intertwine, and I don't know.
So that means like transfer, because can you imagine, for example, a lot of children in Guilford County get mental health services in High Point.
Yep.
And if you're a parent that does not have transportation, or you don't get Medicaid transportation, which that is a whole system in itself, you probably have to like transfer somewhere if there is a transfer.
There is a transfer. Yeah.
So what are your families saying that they need to mitigate that? Because that's going to be hard.
It's super hard. Not enough people even know what I have found. It's like not enough people even know about the Medicaid transportation as an option. So I have been referring and giving people information on how to get back and forth to their doctor's appointments. And they also will take you to get your prescriptions as well.
So that's something new that most definitely our community needs to know. So with the 2 systems, 1 county, what have you been able to do and support families in trying to make that system work?
Unfortunately here, there are a couple of different what we call home visiting programs, like over at the Y, they have the maternal health program. The health department has a program called SimHarp. And each one of those programs, although they focus on the pregnant mom and making sure that she's good, they also give you external resources, because we do know that first of all, healthy mom, healthy baby. But in order to actually support her, it may be more than just medical.
Right.
You know, the social part of it is huge when making sure that she is healthy.
And have you been able to see, because you mentioned before that you guys touch people who touch mom as well. How has been the involvement of fathers in your work?
It goes up and down. I see some that are so involved, so excited. And then I see some who are not. And I think a lot of it is kind of how the system is set up. Because like if you walk into the doctor's office, the support chair of the person, whoever's there to support you, is in the corner. And then the exam table is right up front. And so then the doctors talk to mom all the time. And then they get to sit over there in the corner, play on their phone, look for something else, not pay attention to what's going on. And then for 9 months, everybody's talking to mom and not talking to dad. And then come game day,
right,
he is now pushed to the forefront because she can't talk. You know, she's trying to birth the baby, so she's not talking. And now all of a sudden he has to become this advocate when he hadn't been talked to in 9 months.
So that's a systems change that needs to be made to make the spaces more inclusive to fathers, or even just a change in the conversation. Like, let's move the chair out of the corner.
Move the chair out of the corner. Right. I say, hey to everybody. I ask for Dad's name. Because I don't just keep referring to him as Dad.
Right.
And as a parent myself, I remember when I lost my name.
Right. That's a big point.
Yeah. So I try to bring him to the front and ask him as many questions as I ask her, and let him know you're the most important part of this outfit, really. I know everybody focuses on Mom, but she's just the vessel, because she takes care of one person. You have to take care of two. So you have to look out for the baby and her.
That's a great point. I'm gonna quote you on that one, because they do in order for a community to be whole, all the people who support the family have to have support as well. And so that's something that we can most definitely continue to advocate about.
Thank you for listening to this story from the Institute for Family Shine On North Carolina campaign. Hear the full story and discover how you can share your own by visiting our website at instituteforfamily.org.